Hi, my name is Erin Brownlee. I'm the registered dietitian and certified diabetes educator for the Shoshone-Bannock Tribes Diabetes Project. I have put together a series of videos using the materials from the International Diabetes Center and our tribe to help answer some of the basic questions of diabetes. It is natural for diabetes to change over time. That is why it is important to follow your diabetes success plan and monitor blood sugar trends. These changes happen at different times for different people. Types of changes that happen over a number of years include the body's cells become resistant to the action of insulin. The pancreas first makes more insulin, then less and less as the years go on. The signal from the gut can weaken. Less insulin is released with meals, and more glucose is released from the liver. As these changes happen, your treatment plan will change. It is important to see your provider to discuss treatment changes if your blood sugars become out of range for 4 days. Because diabetes does change over time, your health care needs to change too. Visit your healthcare team every 3 to 6 months. Together, you will review your A1C and other laboratory test results. Complications occur when blood sugar levels are high over time by damaging nerves and blood vessels. High blood pressure and abnormal cholesterol levels add to your risk. Any reduction in your A1C is a step toward better health. Blood sugar levels that are high most of the time can lead to serious health problems. These problems do not happen overnight. You can take the steps to help prevent, delay, or slow the process by keeping blood sugars in target. Foot problems start with numbness, tingling, pain, or sores that will not heal. Taking care of your feet every day helps prevent these problems from becoming serious. It is important to clean your feet daily. Make sure to wash your feet with a mild soap and warm water. Do not soak your feet. Soaking can make your skin dry and cause cracking. Dry feet well, especially between the toes, and trim nails straight across. If you have foot problems, ask your care team for a referral to a podiatrist or foot doctor. Now let's talk a little bit about heart health. Heart health is important because diabetes increases your risk of heart disease. Everything you do to control your glucose level helps keep your heart healthy. Other risk factors include high blood pressure, high cholesterol, and smoking. The more risk factors you have, the higher your risk of heart disease. Some risk factors include having an A1C that is 7% or higher, having a high cholesterol, having blood pressure readings that are 140/80 or higher, if you smoke, or if you eat a high-fat diet. High blood pressure puts extra strain on the heart. It can also damage small blood vessels in the eyes and kidneys. Blood pressure is recorded as 2 numbers. The top number is the systolic blood pressure. It is the pressure when your heart is contracting. The bottom number is the diastolic pressure. It is the pressure when your heart is relaxed. If either number is high, your risk of heart disease is increased. If you have diabetes, your risk of high blood pressure is 3 times higher than people who do not have diabetes. If diet and physical activity do not control your blood pressure, you may need to take 1 or more blood pressure medications. Have regular blood pressure checks. Keep your blood pressure below the target given to you by your healthcare team. Some risk factors for heart disease and blood pressure cannot be changed, such as your family history. Others are related to lifestyle and can be changed. Once you understand your risk factors, you can take steps to reduce them. Here are some tips to help protect your heart. Do not smoke. If you do smoke, start to cut down or talk to your healthcare team about stopping. Choose low-fat foods and use low-fat cooking methods. Avoid foods with saturated and trans fats. Eat fewer salty foods and avoid using the salt shaker. Include plenty of fruits, vegetables, whole grains, and low-fat dairy products. Eat 2 servings of fatty fish per week. Be more physically active. Lose 5 to 10% of your current weight if weight loss is needed. Otherwise, continue to maintain a healthy weight. Limit the amount of alcohol you drink. Ask your healthcare provider if taking an aspirin daily would protect your heart. Balance the stress in your life. If stress is difficult to manage, talk to your care team about a referral to a mental health provider. A physically active lifestyle can help keep your heart strong. Heart-healthy activities make your heart beat faster. Walking is one of the simplest and best physical activities for your heart. First, add steps to your day and then step up the pace. Over time, try to keep up the pace for longer periods. Other physical activities that boost heart health include aerobics, swimming, hiking, biking, and exercise videos. It is important to find an activity that you enjoy and gets your heart pumping. Goals to consider at this time are to continue to monitor and track blood sugars, limit high-fat foods and use heart-healthy fats more often, limit sodium intake. If you are a smoker, begin working through a plan to decrease or quit smoking. Talk to your healthcare team about the smoking cessation program that we currently offer. For further information regarding any of the topics we have covered in this video, please contact the Shoshone-Bannock Tribes Diabetes Project for an appointment.